So the SWOG S2303 is a national SWOG intergroup NCI study that will look at the combination or incorporating nivolumab with a standard of care regimen, paclitaxel and RAM in the second-line setting. It's a phase 2/3 trial. The rationale behind the study is based on the fact or the data supporting that combining VEGF monoclonal antibodies with immunotherapy lead to clinical synergy and better outcome. So there are a number of trials that was done combining those two family of agents in this disease that has shown really good results in the frontline setting as well as in the second and third line setting. And then most recently, there is a study that combined nivolumab with paclitaxel RAM, a single-arm study that looked at this triplet in this population in the second-line setting. The results was encouraging, with superior outcomes seen in patients who have higher PD-L1 CPS score, including progression-free time of around 6 months and better survival outcome of around 13 months, which is better kind of results than what we've seen with PAC-RAM in the Rainbow trial. So this is kind of the rationale. We know that the trial, the single-arm study that combined the triplet was in the immunotherapy naive population, not immunotherapy refractory. However, there is a great unmet need now for the immunotherapy refractory population, now with the change in the treatment paradigm and incorporation of immunotherapy, both nivolumab and pembrolizumab with chemotherapy in the frontline setting in this population. The great unmet need is what to do in those patients after progressing on IO plus chemo. And I think this trial is tailored to address the question on whether continuation of nivolumab beyond progression is beneficial or not. I think using the rationale that those patients will continue nivolumab and Ramucirumab is already a standard of care agent in the second line regimen. So possibly combining this nivolumab with another type of agents other than chemo like Ramucirumab will lead to some synergy and might improve the survival beyond what we've seen with PAC-RAM alone. So I think that's overall the rationale for this trial. It will be we will be looking at progression-free survival as the primary endpoint in the phase 2 part of the study. If we meet our goal for progression-free time, the study will expand to phase 3, looking at overall survival as the primary endpoint. We are looking at around 220 patients to enroll nationally, and looking forward to open the trial toward early March of this year.